Kia ora, good afternoon. I'm Tom McRae and we're breaking into normal programming to bring you the latest on New Zealand's COVID Delta outbreak. We'll take you soon to a news conference at the Beehive where the Prime Minister and the Director General of Health will provide an update on the New Zealand cases. But first, let's take a look at the day's developments. The Ministry of Health has confirmed there are 2 new positive COVID cases in the Waikato community. One is in Raglan, the other is in Hamilton East. The Raglan case is self-isolating and will be moved to a quarantine facility. They were tested on the 1st of October after feeling unwell, and they've been infectious since the 27th of September. A pop-up testing centre has been set up at the Raglan rugby grounds. Anyone with symptoms is being urged to get a test. The second case is a known contact of the Raglan case. They live in Hamilton. They've been transferred to Waikato Hospital. It comes as multiple locations of interest have been identified after a COVID-positive truck driver travelled from Auckland to Palmerston North. They include locations in Taupiri, Hunterville, Putaruru, Taihape and Palmerston North. Additional testing centres have been set up in Hamilton and in Palmerston North. 27 new community cases were reported yesterday. All of those were in Auckland. Air New Zealand has introduced a no jab, no fly policy from the 1st of February next year, requiring customers travelling anywhere on its international network to be fully vaccinated. And the government has also announced full vaccination will become a requirement for non-New Zealand citizens arriving into New Zealand from the 1st of November. Well, health correspondent Lucy Warhurst is with us now. And Lucy, some major developments this morning. What can you tell us about the 2 Waikato cases?
Well, the first one is a person in Raglan. They started to feel unwell on Friday and got a test. That has come back positive, and they're thought to have been infectious since Monday, so a full week. They are self-isolating at the moment and will soon be moved into quarantine. Now, the second case is based in Hamilton East. They are a contact of the Raglan case, and they are currently in Waikato Hospital having treatment for COVID-19. All household contacts for both cases are also in isolation.
And where can people down there get tested?
Well, there are 3 sites set up today. For Raglan, it's at the Raglan Rugby Grounds car park, and there's a centre at Founders Theatre car park in Hamilton, and there's also another pop-up testing station today at Claudelands Event Centre. If you're also one of these who haven't yet got your booking for a vaccination, vaccinations are also available today. Just walk in at Te Awa, that is the base.
And unfortunately, they're not the only cases outside of Auckland. What can you tell us about the truck driver in Palmerston North? Yeah,
that's right. So this was a case we heard about late yesterday evening. They tested positive yesterday through routine testing. This is an Auckland truck driver who travelled to Palmerston North. That's when their result came back positive, and they're currently isolating in Palmerston North. A number of locations have been identified. They're currently working through all of those, and they're also working through any potential contacts.
And what's been the reaction from epidemiologists to this morning's announcement? How concerned are they?
Well, I have spoken to Rod Jackson today, and he has said that, you know, this does jeopardise our move out of level 3 for Auckland. And he's also just saying today that this is the opportunity for people to get vaccinated.
Indeed. Chris Hipkins has also just announced some new vaccination rules for people wanting to fly into the country. What more can you tell us about that?
That's right. So from November the 1st, non-citizens travelling to New Zealand will need to be fully vaccinated before they can enter the country. Chris Hipkins is saying that this is the most effective way to stop the spread of COVID-19, and it's also an important step in reconnecting New Zealand.
Thank you very much. That is health correspondent Lucy Warhurst from our newsroom. Well, the Prime Minister and the Director General of Health have just made their way into the Beehive Theaterette for today's announcement.
Kia ora koutou katoa. Good afternoon, everyone. As you'll be aware, 2 cases of COVID-19 have been identified today beyond the Auckland boundary. One is in Raglan, the other is in Hamilton. The two cases are connected to one another, but at this stage we have not connected them to our Auckland outbreak. I'll hand now over to Dr. Bloomfield to provide an update on these and other cases identified over the past 24 hours before setting out what actions ministers have agreed to today. Dr. Bloomfield.
Thank you, Prime Minister. Tēnā koutou katoa. So today there are a total of 33 new community cases to report. 32 of these are Auckland-based and 1 case is in the Waikato. Now you will have seen, and the Prime Minister's just mentioned it, that actually we are reporting a second case in Waikato, but it's not included in today's figures because of the time it was reported. It will be in tomorrow's numbers. Now of today's cases in total, 15 are yet to be linked. 2 of those have a possible link, and 3 of those 15 are all actually one whānau that live in a single household. Interviews are underway, and we would fully expect that those will identify links and connections to the existing outbreak. And of yesterday's cases reported, just 4 remain unlinked at this point, with investigations ongoing. In the Auckland region, there are now 5 active subclusters. That is where there are new cases that are emerging over recent days, and our public health efforts are significantly focused on those. On to those 2 cases in the Waikato. One of these cases lives in Raglan, the other in Hamilton East, and they are known associates or contacts. However, at this stage, there's no obvious link between these 2 cases and the Auckland outbreak, and we would expect that both the interviews of the cases and the whole genome sequencing, which has been done with urgency, will help us elaborate what that link might be. The case in Raglan and their family has been moved to a quarantine facility in Auckland. That case, the Raglan-based one, was tested on the 1st of October, having become unwell, and their infectious period is deemed to be from the 27th of September. So a pop-up testing centre has been set up at Raglan in the Raglan Rugby Grounds car park on Cross Street, and anyone in Raglan with symptoms is urged to get a test today. And in Raglan, if you haven't yet been vaccinated, now is the right time to do so. There's been quite a big increase in vaccination in Raglan over the last week or 2, which is great to see. Vaccination is available today at the Raglan Area School from 2:30 p.m. Just turn up. The second Waikato case is, as I say, a known contact of the Raglan case and was tested yesterday evening after becoming unwell. This person was transferred safely overnight to Waikato Hospital when the symptoms worsened, and they are being treated for COVID-19 related symptoms. And there are no exposure events at the hospital because they were prepared and ready to receive this person. That second case's household contacts are currently self-isolating, and we are getting rapid testing done on them. So today in Hamilton, the testing centres at the Founders Theatres car park in Hamilton CBD will have additional capacity added, and there will be a pop-up centre at the Claudelands Event Centre that's being set up at the moment. Again, anyone in Hamilton with any symptoms whatsoever of COVID-19 are asked to please get tested and isolate till you receive your result. There are also walk-in vaccinations available in Hamilton today at Te Awa, the base, and the Prime Minister will have further information about vaccination opportunities. There may be public exposure events which will be listed as locations of interest on the Ministry of Health website through the afternoon, so please do watch out for those. A quick update on the Auckland-based truck driver that is also being reported in today's number, and we made a media release about that last evening. So this person was picked up through routine surveillance, showing the value of this testing. They had previously returned a negative test on September the 24th and then tested positive 2 days ago. Their infectious period is deemed to be from the 28th of September. Now that driver, when the positive result came through, was in Palmerston North and is isolating at a bespoke facility on the hospital grounds in Palmerston North. Their 2 household contacts in Auckland are also self-isolating. Both of them have returned initial negative test results, as have 3 other close contacts. Locations of interest between Auckland and Palmerston North over a number of days while this driver has been driving through, mostly petrol stations. They have been put on the Ministry's website, so please do look at those. Again, there is whole genome sequencing underway to determine the link with the current outbreak in Auckland. Just briefly then on hospitalisations, 26 people in hospital today, the majority in Auckland, and as I mentioned earlier, the one person in hospital in Hamilton at Waikato Base Hospital, and 3 of the total number of people in hospital are in ICU, all at Middlemore. Testing continues to go well, and it's hard for me to emphasise enough how important it is for our testing to continue, and in particular anyone with any symptoms at all, wherever you are in New Zealand. Last Friday was the highest testing day for Metro Auckland in over a month, with nearly 16,000 tests completed, a huge effort. Thank you to all involved. And from this Monday, the 4th of October, that's tomorrow, the Otara Community Testing Centre in the town centre there at Otara will be open from 6:30am to help provide access for essential workers to surveillance testing. A reminder that there is also testing ongoing at a number of accommodation places across Auckland, residential facilities, boarding houses, community housing providers. It is voluntary for those residents, and around 50 of those facilities are being moved through over the last few days and in the coming day or two. And finally, all of the facilities there are within all of the testing has been set up as within a 30-minute walk of other testing facilities where we have seen positive cases or close contact. So it's a very mobile population, and we are going out with specific teams to find those people. Back to you, Prime Minister.
Thank you, Dr. Bloomfield. In light of the positive case detected in both Raglan and Hamilton, ministers have agreed today to move these areas into level 3 restrictions alongside Auckland from 11:59pm this evening. I'll now share a bit more specificity around the areas that will be covered by level 3 restrictions. It will include Raglan, then coming from north down south to Kowhata, Huntly, Ngarawahia and Hamilton City, based on the Hamilton City boundary. These boundaries will be published online. Just a word about the surrounding boundary areas. In terms of management of the boundary, in this case, Auckland's boundary will remain in place as it stands. For these new Hamilton areas, there will be spot checks around these boundary areas, but it will not be the same as the hard boundary we've been operating for the Auckland outbreak. The reason for that is simply a practical one. The Hamilton area simply has too many feeder roads for us to successfully operate a hard boundary around the outskirts of the area. So we ask people please to maintain compliance, and there will be spot checks in place. For those who live and work across these areas, we ask that those who can work from home do work from home. We intend at this stage for these level 3 restrictions to apply for the next 5 days. This is the same approach we took when cases emerged in the Upper Hauraki area. It gives us the opportunity to contact trace and widely test in the coming days to assess if the virus has spread widely. If you live in these areas or have visited these areas and are experiencing even mild symptoms, please do get a test. After 5 days of wide testing, contact tracing and wastewater testing, we will assess whether the restrictions need to remain in place. It is noteworthy, however, we have had wastewater testing in the Hamilton area on the 29th and 30th of September. Those have been negative tests. Of course, further testing will assist us as we seek to ascertain how widespread these cases may be. But testing is not my only request of those who live in this area, or indeed those who live anywhere in Auckland. It is not a coincidence that those in our current outbreak have not been vaccinated. Those who have not had a vaccine in New Zealand are currently in the minority, but they are the vast majority of our cases. That is because the vaccine works, but it's also because the virus is literally finding unvaccinated people. Vaccination makes a difference. It keeps people safe, but it also gives us choices. And this is how stark those choices are. If we had a vaccination rate at 90% or above in either Hamilton or Raglan, it is highly unlikely that we would be here today announcing level 3 restrictions. Instead, we would be able to rely on other tools like contact tracing and much lower level public health measures. But while we are still vaccinating, we have fewer choices in how we react to cases. And so this is a message for the rest of New Zealand. We are doing everything that we can to keep cases confined to Auckland and managing them there. The people of Auckland are sacrificing a lot to do that too. But they are doing that to give everyone else time to be vaccinated. If, in the meantime, the virus moves beyond the Auckland boundary and the places it moves to have low vaccination rates, then today is an example of how we will need to respond. So please, get vaccinated today if you want to avoid level 3 in your community, and we can avoid it in the future. Now, I know some people are nervous about the vaccine and wanting to wait a bit longer to see what happens. I understand. It's natural to have questions, but I can assure you the vaccine is safe and the experience is friendly and supportive. There are nurses and healthcare professionals on site. You get looked after, and if you have questions, you can ask them while you're there with people who are knowledgeable and supportive. There are still 887,000 eligible New Zealanders who haven't been vaccinated. But on the flip side, 79% have had their first dose. We have a different approach to COVID within our sights and in our hands. So as we all look ahead and we think about summer and the plans that we are making, make the first step a vaccine. It is the thing that will make those summer plans possible. So on that note, in the Waikato, there are 1,500 bookings available today and 2,800 available tomorrow. In terms of walk-in vaccinations that are available right now, you can find those at Te Awa, the base. Rokua, Haora or Tainui is open until 3:15 today. Rahui, Pokeka and Huntly, the Community Vaccination Centre, is open for walk-ins until 3:30. Anglesey Pharmacy is open until 11 p.m. Sanders Pharmacy until 3 p.m. And there are approximately 80 pharmacies, GPs and vaccination centres, including mobile services across the Waikato. Also today, there will be a pop-up vaccination centre in Raglan at 2:30 p.m. today, and we'll make sure that we put details of that out for anyone locally. Before I finish today, a quick reminder that tomorrow we'll be talking more about our roadmap forward, in particular for Auckland. On Tuesday, we have another step up in our vaccine campaign, and you can expect that alongside each day our reporting on developments in Hamilton. Till then, though, we are now happy to take questions.
Is there anything that you can tell us from the preliminary contact tracing interviews about these two Waikato cases, whether they went to any potential super spreader events, whether they were in front-facing employment?
So we do know that we will have a number of locations of interest around, in particular, our Hamilton case, and we'll continue to publish those. We've had it described to us that they've moved locally over a period of time. We can make an assumption around infectiousness given that they infected the person in Raglan on or around the 26th of September, so that gives you an idea of the window timeframes that we're looking at. I haven't been advised that there's been any movement outside of the region as yet. And at this stage, we have not identified any movement from anyone from Auckland in contact with this family. But that's a key part of our source investigation.
Days for the Waikato in level 3, is that going to extend to Auckland as well? Will it remain in level
No.
3 for longer
No,
periods?
so what is happening here in the Hamilton area and surrounding area, think of as discrete measures for that area. Because obviously what's happened here is we've got a new outbreak in the Hamilton area, so we'll be treating that distinct from what we're dealing with in Auckland. So we'll still be making announcements on what we intend to happen in Auckland tomorrow. I'll let you finish, Tiger, and then I'll come to Jane and then Derek.
Why not do the same thing for Palmerston North? Why not?
Yeah, a bit of a different set of circumstances for that individual. I'll let Dr. Bloomfield talk a little bit about what we've managed. One thing we know is, obviously, having come from Auckland, we know the source. So that's really key. We know that someone, this is a person in Auckland, so it's easier to connect it to our Auckland outbreak. We also know all of their movements. Here, we've got 2 cases. We don't know where those individuals got it from, so therefore it's harder for us to define the edges of that outbreak, so that makes it very different.
Yes, so the person in Palmerston North just happened to be in Palmerston North when the positive test came through and is therefore being isolated and managed there. The exposure events, including locations of interest, are all identifiable, and this person is Auckland-based and obviously as it works as a driver going down. So we're not worried about there being undetected community spread in Palmerston North. So saying, of course, we're wanting testing there of anyone who's symptomatic, and we are increasing wastewater testing in Palmerston North and some of those surrounding towns. Sorry?
No.
They weren't vaccinated?
No, in the Palmerston North case was not vaccinated. None of the individuals from Raglan or Hamilton were vaccinated. And this is, I think, one of the points I wanted to make. Here we have a situation where actually the vast majority of New Zealanders eligible now are being vaccinated, but the virus is finding our unvaccinated individuals. Interesting and of note, we've been advised that the household members of the Palmerston North, the truck driver, are vaccinated and have not yet tested positive. Jane, I'll come to you.
What can you tell us about those subclusters in Auckland, for example? Are they connected to the emergency transitional housing population, and are any of those results, those positive results from the testing within those facilities?
So the subclusters that are connected to transitional and emergency housing are ones we've already talked about during last week. There are 2 more new emergent ones, but they're not related to the housing sort of situations. Yes, and some of those positive cases, a number of those positive cases coming through today and yesterday are from those subclusters that do involve transitional housing. But as far as I'm aware, none have been discovered through the surveillance testing we're doing of the other locations. They have all come out of the places we knew there were already active cases and within the family and contacts there.
Also, Prime Minister, can you just talk a bit about the vaccination requirements at the border for non-citizens?
Yes. So you will have seen today 2 significant announcements. One from the side of the government, where we've now announced that it's our intention in the future to require vaccines for non-citizens entering into New Zealand. At the same time, you will have seen that Air New Zealand has announced a requirement for individuals using their international services to be vaccinated. I don't think either of these requirements will come as a surprise to New Zealanders. Of course, we are pushing very hard to have as many people vaccinated in New Zealand to keep them safe. It makes sense that we ask that at our border for those who are non-citizens.
Will this bring us into line, I suppose, with other countries and potentially, will it relieve pressure on MIQ? Does that take out a certain cohort that would otherwise be coming
Certainly,
through?
it helps prepare us for the future. You will have seen that part of the Reconnecting New Zealand work talks about greater flexibility for fully vaccinated individuals, shortened periods of isolation, the possibility of self-isolation at home. All of that is predicated on people being vaccinated. So it is if you like, a precursor to greater flexibility at our border. For me, this is. Why should New Zealand carry the cost of individuals who are visiting New Zealand who choose not to be vaccinated? And it is a cost in many, many ways. It does not extend to citizens because, of course, we cannot preclude New Zealanders from being able to return to their home and put a condition on that includes vaccine.
Last week we reported that there are actual real problems with the security of the vaccine confirmation because of the way that it is at the moment. You don't have to present ID. You could, it's basically a written letter. Given this is becoming so important and will be, what's being done to make sure that it's proved that people who say they're vaccinated are, and actually that they have the document that can prove it properly?
Yeah, and this is one of the issues, in part that has meant that we've taken this approach at this point has been actually we do not have internationally a system of documentation that can be universally recognised. We have the backup measure at the moment, though, that we are still using measures like our quarantine facilities that add that extra layer of safety. So we've got that as a backup. But in the future, you will certainly want to be able to rely much more meaningfully on documentation. New Zealand is working up a system that essentially aligns us with internationally recognised systems like those being used by the EU.
Aren't the big holes at the moment, though, in the actual documents that people are getting, like the vaccinations now? Realistically, if you said prove...
Just to narrow down, and I'll have Dr. Do you mean internationally or for us?
Just at the moment, with the system that you can log on, you don't have to prove ID. So, someone else could go and get vaccinated in my name, for example, and I could get the certificate and then I'm vaccinated.
And that individual would never then be able to carry their own documentation. It is quite an effort for someone to go to have someone else to be vaccinated on their behalf in order to then acquire their documentation in an environment where in the future every New Zealander is likely to need their own individual documentation. The issue actually for us at the border is the international documentation, because there isn't a consistent approach. And that is one of the things that, yes, we've got our own systems for checking, but in the future I hope we will have a system that works a little more robustly. But Dr. Bloomfield.
So 3 things here. First of all, we made a deliberate decision, and I think it was the right one, that people didn't need to show ID when they went and got vaccinated. But that doesn't mean they don't have to identify who they are so that we can link them into the system. So as having my experience this morning, I was asked 3 times my date of birth. And so people have to be able to be identified and linked to an NHI number. And through that NHI number, we can then record the vaccination in the COVID immunisation register. Yeah. The second thing is, at the moment, yes, people can make a request to be sent a letter to say they have been vaccinated, and people will realise that early on in the program, and still in many places, people would get a card manually recording their vaccination. However, as we move into this next phase, this is becoming an electronic process that will require people to identify themselves and provide a form of identification when they register to then be able to provide proof of their vaccination status. And so that part of the process, when we move into the next phase, will link identification of an individual with their vaccination status.
Come to Mikey and then Derek.
Dr. Bloomfield, did you get your second jab today?
I did.
How was it?
Well, it's a nice feeling to be fully vaccinated, and in another couple of weeks I'll be fully immunised, and I'm hopeful that the next day or two I feel fine.
Just in terms of the truck driver, you say that both household contacts were vaccinated. Does this show that the truck driver may be vaccine hesitant, and does it also show that those who are essential workers moving out of Auckland should only be able to do so if they are vaccinated?
Yeah, so look, one of the things that we are considering is whether or not, in addition to the testing requirements, and the testing requirement at our boundary in Auckland is what has enabled us to pick up this case, whether in addition it is therefore a reasonable expectation to have a vaccine requirement alongside it. But I think what we need to remember is that, as unfortunately is the case today, it's not necessarily the fact that we will have a border forever between Auckland and the rest of the country. We need all of New Zealand to be vaccinated. Auckland at the moment is in level 3 restrictions and containing this outbreak to give all of us time to be vaccinated, time to keep ourselves safe, and the opportunity to ensure that in the future we aren't in the position where we have to contain this virus by using level 3 restrictions.
Because in terms of international...
We're going to break away from the news conference now, but you can keep watching on our website, newshub.co.nz. So just recapping those key points from the Prime Minister and Director General of Health, there are 33 new cases of COVID-19 in the community today. 32 are in Auckland, while 1 is in the Waikato. The second Waikato case has not been included in today's figures, but will be included tomorrow. 15 of today's cases are yet to be linked to the current outbreak, but 2 have a possible link, and there are now 5 active subclusters in Auckland. A level 3 boundary will be set up around the Waikato outbreak. It will extend from Raglan to Huntly, to Kowhata, Ngaruawahia and Hamilton City. It will be in place at 11:59 tonight for at least the next 5 days. Well, thanks for watching this News Hub special. I'll be back at 6 o'clock with a full wrap of the day's developments. I'm Tom McRae. Good afternoon.